Welcome to the Long COVID podcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to this episode of the Long COVID podcast. I am delighted to welcome my guest today, Dr Viki Male, who is here to chat about her research into long COVID and menstruation, which we know can be a huge factor in many with long COVID. So this is going to be really interesting. So a very warm welcome to the podcast.
Hi Jackie, it's nice to be here.
Thanks so much for joining me this morning. So to start with, would you mind just saying a little bit about yourself and what it is that you do?
Yeah, so my day job really is looking at immune cells in the lining of the uterus. And I'm really interested in how those are involved in making sure we can have a healthy pregnancy. So how they help the placenta to implant at the beginning of pregnancy and how they might help birth to happen at the end of pregnancy. But as part of that, they cycle during the menstrual cycle so that they're ready at the time that you might be having an embryo implanting to kind of help that embryo to implant. So I've also always had this interest in the immune system and the menstrual cycle. But kind of during the pandemic, I ended up, like so many scientists, going in different directions. And one of the directions that I went in was, a lot of people started to say, when I got the COVID vaccine, I noticed that it changed my periods a bit. And it was really difficult to know because we don't actually talk probably as much as we should about our periods, about whether that was, a real difference that was happening because of the vaccine, or if it was just that people were being a bit more aware of their periods. And so it was kind of, a bit of an illusion. And so I did some work to find out if there really was a change to periods associated with the vaccine. And the short answer to that is that about 1% of people will have a later than usual period in the month that they're vaccinated, and about 4% of people will have a heavier than usual period in the month that they're vaccinated, compared to an unvaccinated group. But importantly, it goes back to normal really quickly, like the next month. So that's kind of what took me into period research in the context of the pandemic. But what I'm here to talk about today is long COVID and periods. And that's something that I got into because someone who I know your podcast knows, Jez Medinger, got in touch with me after he'd read some of my vaccination and period work. And he was like, you know what, all the people that I talk to as part of my long COVID stuff, a lot of them are noticing effects of long COVID on their periods, effects of their menstrual cycle on their long COVID. And that's something that maybe it would be interesting to research. And he got in touch with me about 18 months ago, and it has taken us about 18 months to get set up and to get ready and to start answering those questions. But literally just in the last couple of weeks, we have got to the point where we have all the ethical approvals we need to get started answering those questions. And so I'm hoping I'll be able to tell you a little bit more about, exactly what we think is happening, why, and how we hope we're going to find it out.
Yeah, I mean, this is so exciting, isn't it? I mean, I think, you kind of touched on it, and it still seems to be a little bit of a taboo subject, doesn't it? Even in, 2023 now, I'm sure we talk more about it than we used to, but, it's still that kind of like sort of slightly icky subject where we don't sort of talk about it, do we? So, I mean, hopefully things like research, things like more visibility, that will only help, I hope. But there was something that you said about there being immune cells in the lining of the uterus where I went, whoa, because we hear about the immune system and the gut working quite closely together, don't we? But the fact that it also, are there immune cells in every part of our body?
Yes, pretty much, actually. There are a few parts of our body where we have a word immune privilege, and they kind of really do try to keep the immune cells out. So our eyes are a good example of that. One of the very first organs we were able to transplant successfully is the cornea, and that's because you don't really have an immune system in your cornea, which makes it really easy to transplant. Your brain, when it's working properly, usually doesn't have that much in the way of immune cells, but all of the sort of places where your body meets the environment. So your gut, you've mentioned, your lungs, obviously, is another example, your skin, your uterus, where the environment is a very specific thing in the uterus, because the environment might be, an implanting embryo. All of these actually have really rich specialist immune systems that are very important for how they function. And of course, we also have immune cells in our blood and in other tissues like the liver.
Yeah, I mean, that really is fascinating, isn't it? I think it's, I notice this in myself where, I'll listen to somebody talking some, really quite specific medical jargon, and I'll be like, you know what, I actually kind of understand that now. And I think, I think it's this thing with people with long COVID, and it's probably true of many chronic illnesses before long COVID came along, where we kind of have been forced to be our own kind of doctors and to do our own kind of research, and to the point where actually we're quite knowledgeable now, and it sort of comes upon you by surprise almost, I think.
And this is something I've noticed actually, working with, I don't like to say patients really, but, people who have lived experiences of whatever it is I happen to be working on at the time, whether that's pregnancy or the menstrual cycle or long COVID, is that actually it's really easy for scientists to be like all up there in their terminology and thinking that other people can't understand. But actually people who are motivated to understand because it has an impact on their own life and their own decisions absolutely can. Like, absolutely, we should try and, meet them part way and make it easy for them to understand. But, even when we don't, even when, people just read papers that are written for other scientists with no concession at all to non-scientists reading them, when they are motivated to understand because it's important for their own lives, they do. And I think it's so important for scientists to understand that about the people whose work we're hoping that will improve their lives.
Yeah, exactly. And it's this idea of patient participation kind of thing that I'd never come across before being kind of in the long COVID world. And suddenly it was like, what do you mean patients are involved in research? Isn't research something that, like really clever people do in labs and white coats and things? And sort of realizing that, yes, of course, that side of it is extremely important, and research couldn't happen without those extremely clever scientists. But actually that the patients have a huge role to play as well in this, because if it wasn't for them, then you wouldn't be doing the research, and they're the ones that actually are going to benefit from it in the end. So it's this kind of collaboration kind of experience that was like a bit of a mind-blowing moment for me when I realized that that was a thing.
Yeah, and actually this is something as well that I think scientists are learning as well, because it's definitely become more of a thing recently, and rightly so, because, it's very easy to design a study where actually, what you're measuring is not what people care about. The people who are really impacted care about. You can design a study where you're like, oh, we'll increase your oxygen saturation by 0.5%. And people are like, I don't care about the number. I care about how I feel. So, I think it's really important, and we're doing it more and more, and I think we need to keep doing it more and more. But this is really great, because it actually kind of brings me on to talking a little bit about, what some of the people living with long COVID have said that has kind of inspired us to start doing this research. So there are really two aspects to long COVID and the menstrual cycle. One of them, which I'm not working on myself, but we can definitely talk about, is how having long COVID affects your menstrual cycle, because a lot of people notice something going on there. And I think that's really important work for the future, but it's not unfortunately what I'm doing today. But the really interesting thing that we did in kind of putting together our study is we asked, I think it was about 450 or 500 people who have periods and who are living with long COVID, about whether they noticed a pattern to their long COVID symptoms that changed over their menstrual cycle. And 30% of people right off the bat was like, no, I don't notice any pattern. That doesn't describe my experience. But what was really interesting was that those people who did notice a pattern, they really quite well agreed with each other about what the pattern was. So more than 3/4 of people who said they noticed a pattern said that their symptoms they felt were worse in the run up to and during their period. So this straight away tells us, well, if we take this at face value, this straight away tells us that, hormonal changes happening over the menstrual cycle might have an impact on long COVID. And as soon as we know that, we can start doing things. So a lot of people do things like tracking their symptoms and planning things for times when they think they will and won't feel, more able to do them. If those people have that experience themselves, that they know that just before their period is a really bad time for them, they can work around that. But if we can kind of really nail this down, which we absolutely haven't done yet, but if we can really nail it down, it turns out to be a real thing, we can start to say, okay, if there's a hormonal effect of the menstrual cycle on long COVID symptoms, maybe for some people, taking hormonal contraception, or maybe people who are a little bit older taking hormone replacement therapy, that might actually really help them to manage their symptoms. And, it's not necessarily getting at the cause, which we don't really know yet, but helping people to manage their symptoms would, I think, be a really big step forward. So what we're aiming to do, number one thing is, obviously here we had 450 odd people, so it's not a massive sample. And also we were asking them, to think back over kind of, their previous experiences. And this is the answer they came up with for us. But I think it's really important that we confirm that in a much larger sample. And ideally in a sample where people are kind of logging their symptoms in real time. And even more ideally in a sample where people don't know that they're logging their symptoms as part of a menstrual cycle study, because of course, as soon as you know what the study's looking for, your expectation of what the study's looking for can impact, with the best will in the world, even if you're trying not to be biased, can impact how you feel about what's happening. So one of the things that we've just got permission to start doing, so we're going to be working with the app Visible. And we've got permission to use data from them if the people who are using Visible tick a box to say they agree that we can, to basically ask this question on a really big scale, with all the app users of Visible, of those who have periods and who put their period data into the app, which lots of people do we see this pattern of menstrual cycle and just before the menstrual cycle being a worse time for long COVID symptoms? And digging down further, I think another really important question is going to be, some people have different experiences of long COVID. Some people have more of a fatigue experience. Some people have more of a kind of like gut problems experience. Is it actually different what kind of long COVID symptoms you have as to how it changes over the cycle? Maybe this is something that's really, really bothered people who have fatigue, but it's less problematic if you have gut symptoms. And then another really important thing we're hoping to find out in this study that we're doing in collaboration with Visible is people who are taking hormonal contraception, do those people we might predict that they would have less bad symptoms, but we could totally be wrong. So are they less bad, the same, or maybe even worse? So these are the things we're really hoping to find out over the next kind of couple of months, digging into this enormous set of data that we're hoping to get if people who use the Visible app agree that we can analyse their data to find this out.
Yeah, I mean, that's amazing, isn't it, that you have, again, assuming that people tick the right box to say that they are happy for you to use their data, just having access to that amount of people without having to, I've heard a lot of people, doing research saying that actually they struggle with recruitment. It's one of those things where, we want research and we want to be involved in things, and why haven't we got more research? But actually, when there is then research, it can be quite hard to get people. I think some studies have quite strict criteria, but I think it's a lot of effort being involved in research as well. And when you're struggling with energy, you want the research to be there and you want it to be done and you want people to be involved, but sometimes you don't want it to have to be you, which must be really difficult for you as a researcher.
No, absolutely. And I'm involved in another study, which I'll talk about later, where we would be asking more of the participants. And I'm so aware that, for our long COVID cohort, just, getting on with their daily activities can be difficult for them. And then on top of that, we're like, can you come and give blood? And so we so appreciate it when people do. I had a little bit of a struggle with this actually when I was getting the ethics approved for all of this, because I felt, and Harry, who runs Visible, felt as well, that, it was so important that we make all of our information screens like quite short, to the point, because many of the people who we would like to recruit have difficulty concentrating. That's one of the things, right? So I was trying to keep all of my information as short as possible. And when we go to the ethics committee is like, no, can you actually make it 3 times longer? And although I understand why they wanted to do that, because it's really important, that people are completely informed about the study, I had to have a kind of discussion with them where I said, well, like part of the point is that these people, some of the people we're hoping to recruit, can only really manage 1 screen of text on the mobile phone. So you can make me make it 3 screens of text, but what will happen then is that they might not read the second 2 screens. So isn't it better that we have, it's short, we get across everything that we really need to, in order to kind of conserve people's ability to concentrate so that they can, so we get across the most important information straight away. And in the end, we came to a compromise. But it definitely is one of the issues in working with people who are living with long COVID, the fact that for a lot of them, concentration can be a difficult thing.
And I guess this comes back to what we were saying before about how it is so important to be working with and listening to those people with long COVID. And it sounds like you've really done that through Harry himself, obviously, but also, presumably through lots of other people that you've been in contact with. And, you really understand that actually, a lot of people couldn't do that much. So if you make it too difficult for them, then they just won't. And then you'll lose a whole load of your sample size, won't you?
Yeah, you might lose your sample size, or people might, and like heaven knows, I don't live with long COVID, but I do this myself, here are the terms and conditions. Do you accept them? And they're like 17 pages long. You just scroll to the bottom and go, yes. And we don't want people doing that in medical research. We really do want people to understand what they're doing. So I think that's why it was really important to make sure that we could get the information across in a concise way that everyone would be able to access.
Yes, absolutely. Yeah. And I think, it's so important, isn't it? Because it's people's health, their data, it's important that they understand what they're signing up to, I suppose, isn't it?
Yeah, but we are hoping, the Visible thing, obviously it's data that people have already entered, and it's data that they're entering anyway for their own, to keep track themselves. So it's very, very, in terms of what we're asking people there, a light touch study, extremely light touch. But yes, of course, there are data protection issues, but, those are taken very seriously and everything's anonymised before it leaves Visible. So we've got that all sorted out. It's just important that people understand it.
Yeah. We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Viki Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us. Definitely. But yeah, going back to what we were saying before, this sort of idea of symptom exacerbation in the sort of end of the luteal phase, I think, is where it tends to be. That's certainly been my experience and those of what I've heard from a lot of other people.
I'm going to stop you a tiny bit, and I'll tell you why, because I know that not everyone straight off the bat will go follicular phase, luteal phase, and know what we're talking about.
Yes, so let's go into that a bit more specifically, yeah.
So let's just, before we start talking about it, let's just talk a little bit about the menstrual cycle. So for a lot of people, the menstrual cycle lasts for 28 days, but it's completely normal for it to be as short as 25 or as long as 35. And it's actually completely normal for it to vary quite a lot. But let's just talk about, the, in inverted commas, average 28-day cycle. So the first day of your menstrual cycle will be the first day of your period. And then we would have what we call the menstrual phase, which is the time during which you're having your period. So you've got some vaginal bleeding. And then we have a period which is called the follicular phase. And that's because there are follicles in the ovaries that at that point are developing. And at this point, the follicles in the ovaries are developing, and also the lining of your uterus is starting to build back up after you lost it during your period. And I'm going to try and just call that the first half of the menstrual cycle while we're talking today to make things easy for people. And then we have ovulation, which kind of just divides the menstrual cycle in half. And we have the second half of the menstrual cycle, which, as you said, is often called the luteal phase, because at that point, the follicle that released the egg turns into something called the corpus luteum, which secretes progesterone. And that causes the lining of your uterus to become really thick and to start producing secretions, which will help to support the embryo if one happens to make its way down there. So that's the second half of your menstrual cycle, and it's really progesterone dominated. And then about 2 days before your period happens, we'll start to see the corpus luteum involuting, or a little bit before your period happens, the corpus luteum will involute. So that's just a fancy way of saying basically it dies, it gives up. And because it was making the progesterone, that means you no longer have what's been maintaining that lovely thick lining of your uterus. And when that signal to maintain the lining of the uterus goes away, then it will start to break down. And you will notice that most obviously as the beginning of your next period, and the cycle starts again. But it's really important to say, and I think this will get us back onto what you were talking about in terms of your own experiences, that even though the obvious sign that the cycle starting again is the first day of your period, a lot of people will feel that 2 days when the progesterone is declining. And so a lot of people will feel, maybe not quite themselves, might have problems with their temperature not feeling quite right. Some people feel a little bit hot and gross during that time. And so even though the cycle hasn't started again, a lot of people will feel that. And I think this plays into, everyone actually, a lot of people have this experience, but I think particularly I'm hearing people with long COVID. So having just done that tiny little bit of terminology to make sure everyone was on board with it, I'm really sorry to have interrupted you. Do you want to go back to what you were talking about?
Yeah, no, I think you're absolutely right to do that, because, not everybody will 100% understand that, and it's always good to have a reminder as well, because I think something that I've noticed is actually, if you'd asked me 3.5 years ago before I got ill, what happened, I would have been like, I don't know, stuff happens and then that happens. I would have had very little idea, and it's only through actually kind of, trying to work things out that actually I've understood a lot more, and understanding a lot more has helped me to really, be able to, kind of work with it. I was going to say try to fix it. You can't really do that, can you? But to kind of, work with it, because I think that's the thing, isn't it? It's this kind of end phase, so the end of the luteal phase just before the period starts. That tends to be where people will really notice. Like you say, people would have noticed it anyway, probably before long COVID. I certainly did, but I would have ignored it and pretended that everything was fine. But then, when you end up with long COVID, suddenly that is where you tend to get symptom exacerbation. And I remember a big moment for me was when someone said, oh, a progesterone, that's a respiratory stimulant. And I was like, whoa, so my breathing is going to increase then anyway? It's not just, so it's all kind of when it comes together and you start to kind of understand a little bit more. It was like, oh, okay. But this does seem to be, again, anecdotally, a big thing in this kind of phase, doesn't it?
Yeah, and what's really interesting to me, and kind of another reason that I got into this, was that as an immunologist, even though this isn't kind of exactly my area, we've always known that certain autoimmune conditions get better in pregnancy, and some autoimmune conditions get worse. And there's an extent to which the second half of the menstrual cycle is a lot like pregnancy in terms of, the hormones and what's going on with your immune system, because the second half of the menstrual cycle is your body preparing to be pregnant, just, if it happens to have happened.
Just in case.
Just in case, exactly. We're very unusual, actually, among animals in having this system where we kind of do a little mini practice pregnancy just in case we are pregnant, and then we give up on it if it's not worked. Like most other animals don't do that, and it's really interesting. One of the things that makes working on human reproduction quite tricky. But what was really interesting is, for example, MS. We've known for ages and ages that people will get a lot better when they're pregnant with MS. And similarly, though, people with MS will often feel a lot better in the second half of their menstrual cycle when we're having this like little mini practice pregnancy. And then as soon as the progesterone goes away, you know, in the couple of days leading up to your period and then your period, people with MS will often really feel a lot worse. And so when I heard people with long COVID talking about their experience being like this, I was like, wow, that really sounds a lot like MS. And also IBD, which also has a kind of immune component to it. There's some evidence that that's a lot worse during your period. And the particular study that I'm thinking of is really good because they took a cohort of people as well who didn't have IBD, and they kind of gave them a challenge which doesn't sound too pleasant, but fundamentally they put a balloon up their rectum and inflated it a bit and saw how much it bothered them. And they did that with the IBD cohort and with the non-IBD cohort. And kind of in agreement with what the IBD patients were saying, they were a lot more bothered by it during their period. But what was really interesting was that the non-IBD patients, they did not have that experience. So that tells you that it's not just sort of like general, oh, we all feel a bit gross during our period, specific to IBD in that study because they had a control group who weren't experiencing it. And this is kind of another thing that led me on to wanting to work on this, and led me into collaborating with someone who's probably a long COVID researcher, which I don't consider myself to be. I'm learning. But so I've also started a study, or rather Danny Altman at Imperial, like me, has a study called the Wilco study. And it's a really big study that's including lots and lots of people with long COVID and is basically asking the question, are there differences to the immune system when you've got long COVID? And is that maybe what it is that's, causing your problems? And if you can work that out, again, you've potentially got the opportunity to treat it. And so when I got this data from Jez, I was like, oh, that's really interesting. It sounds a lot like MS. And I knew that Danny was doing this study where he was working on the idea that long COVID might be autoimmune. And I got in touch with him. And we kind of started chatting, and there was the opportunity to apply for some money. And I said, well, you know what, if we can get this money, can we perhaps just add a little bit into your study where we really drill down and we focus on a very specific cohort of people who have long COVID and who have periods, or who don't have long COVID and who have periods. And we take blood samples from them at multiple points throughout their menstrual cycle. And this is the study I was talking about where I really feel like we're asking a lot of the participants, but I hope that some people will be able to do it because I think it will be very interesting for finding out why this is happening. And so that one, again, has literally just started recruiting. It's at the moment, we're ideally trying to get people who live near the Hammersmith Hospital, which is where Danny is, because it's just much easier for them if they live near the Hammersmith Hospital. So if anyone's interested potentially in taking part in that, I've given you our email address for the show notes. Altman with 2 N's, long COVID study, all one word, at imperial.ac.uk is our study address. So anyone who is living with long COVID, who has periods, who is between 18 and 45, and who is close enough to the Hammersmith Hospital in West London that they reckon they could come in 5 times in a month. So we are asking a lot, but I hope someone will be able to. Please do email us because we'd love to hear from you.
Yeah, absolutely. I can see why you would want them to be living quite locally for that. Yeah, that's amazing. So is this 2 strands of the same study then? The sort of the visible data and the blood samples, or are they sort of more separate?
Well, in my head, they're 2 strands of the same study because I think that, the visible data will tell us something really important about how symptoms change in a really big, unbiased way. Meanwhile, the data from the Wilco study will tell us about how the immune system changes in probably a really small way. We're hoping to get 30 people, but we realize it's a big ask, so we might not get 30 people. And I think that by combining these together, we'll find out quite a lot. From a kind of like ethical review point of view, they're separate studies, but I think that, thinking about it scientifically, they're really part of the same push to understand how long COVID symptoms change over the menstrual cycle, which we'll mostly find out from visible, and then why they change over the menstrual cycle, which we're hoping we'll find out from the collaboration with the Wilco study.
Isn't that cool though? That you know, that you've got, I don't know, just yeah, like I said earlier, just access to so much data for some of it. And I suppose this comes on to sort of the next thing I was going to ask was sort of when are you expecting to be able to find any sort of results? Because you know that's the thing with research, isn't it? It's like we're going to do this really exciting idea, and isn't this brilliant? But then oh, but actually it's going to take time. And I think this is something that as a person with long COVID, we find intensely frustrating. But then when you realize quite how much stuff you and your team has to do, it's kind of like, oh, okay, that's, you know, it's still frustrating, but I kind of get it. Like that's a lot.
Yeah, and of course, it's really important to us that before we say something, like let's say we came along and we were like, oh, doing this will help. We want to be sure that we're right. You know, we don't want to rush it and tell you to do and say that something that won't help might help, and everyone spends 6 months eating cucumbers because the study seems to suggest that cucumbers somehow help. So it's important, yes, that we take our time, that we get it right, particularly with respect to the menstrual cycle study. Just in terms of, well, for the visible aspect of it, in terms of like the amount of data that there is, that's a challenge. And then in terms of the Wilco study, because we have to get people to come back to give multiple samples, like even just the experience of one person giving the samples will happen over a month. And that's before we even start doing any science. So menstrual cycle stuff is quite often slow because you can't just take one sample. So there is that aspect. I mean, the other aspect that's been a little bit frustrating for me is during the pandemic, things to do with COVID ethically were quite often fast-tracked. And that's not to say that, the requirements were any less than they usually would be, but they went to the top of the ethic committee's pile. And that's no longer the case. So in terms of getting these studies approved, it's actually taken us a year, basically. And that was kind of disappointing for us because we know that the community would like answers quicker. And that year was a whole year when we couldn't do anything because we weren't allowed to, because we hadn't got the permission to. So that's kind of why we're starting now rather than starting 18 months ago, which we would have loved to do. But in terms of kind of like our timeline, we are literally just starting to recruit for the menstrual cycle sub-study of Wilco. I was looking at our participant database this morning, and the recruitment emails went out. Some of the recruitment emails went out yesterday, and the first person to fill in the form to say, yes, I'll do it. The form was on my desk, well, virtually on my desk this morning. So we've got our first recruit there. That's where we are with Wilco. And then in terms of visible, the study's going to be released, I think, in a couple of weeks' time, and we'll see how that one goes. But yeah, we're still so close to the beginning. And part of me thinks that actually, your experience, for example, of having had long COVID for a really long time and now luckily beginning to feel a bit better, means that hopefully there will be lots of people who, before we can tell you the answers to this, will be feeling better anyway. That's what I hope. But it will still be important for the people who aren't feeling better. And also, I think we now have to put an eye to the future and to, sadly, this will not be the last pandemic I see in my lifetime. I'm sure we'll have another one just because of how these things work. And it would be really good in the future to have a really strong basis of knowing all about what happened in the COVID pandemic, so that maybe next time, right out of the bat, we can say, well, in the COVID pandemic, we found out that this helped with long COVID. And straight away, we'll have, ideas and things to test if we ever end up in a situation like this in the future.
We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much. Yeah, because I think, what I, again, have not really realised, because it's just not something I'd ever experienced. But, having suddenly ended up with long COVID and realizing that actually chronic illness is an extremely understudied area of medicine, and then combining that with menstruation, which is also quite an understudied area of medicine because, well, partly because of the reasons that you've just outlined, but it's really difficult because it changes all the time. So I suppose when you then combine the two, you're thinking, well, actually, these are two understudied areas that are kind of coming together, which is making this research more important, partly for now and in the future.
Yeah, exactly. And I guess even outside of a pandemic situation, we can have a discussion about the extent to which long COVID is kind of just a COVID associated version of MECFS. But of course, MECFS continues to be a thing. So it might be useful for people who have that to find out a little bit more about how the menstrual cycle affects it.
Yes, absolutely. And I think when I spoke to Harry Leeming maybe 2 months ago, I think, and we had this thing where we were saying, oh, no one's looked into menstruation with all of this, and isn't it this exciting that you are? And then before the episode aired, about maybe 2 days later, this paper from the patient-led research collaborative, Lisa McCorkle and team, sort of came out, and me and Harry sort of went, oh, that's a bit embarrassing. But, at the time when we were talking, it hadn't come out.
But also, like, when I saw that come out, like, part of me was like, oh, brilliant. Someone has put together, like, all of the background to what's important for my study into this review. Like, brilliant. So much work has been done, to get us off the ground. And then I read it, and the people who've put it together have done a brilliant job, but a brilliant job in an area where there's not a lot of research. So, there are various things there that kind of fit in with what we're seeing with long COVID. So one particular thing is that people with MECFS do tend to report worse symptoms in the premenstrual phase and the menstrual phase. So that really lines up with what our sort of COVID cohort are saying to us. But then actually, looking into it, like, what's the mechanisms? Are we definitely sure? Going on to that flip side question of how does long COVID or MECFS affect the menstrual cycle rather than the other way around? What's known about that? They've done a brilliant job of collating what's known, but the answer is actually still not that much. So I think there's a real knowledge gap here that I'm hoping that we can fill.
Yeah, definitely. And it is exciting, I think, that this is now an area that is beginning to be looked at a bit more. I mean, it's also like, why on earth haven't we done this before? But at the same time, it's great that we are now.
Well, one aspect that paper brought up, which we haven't really talked about yet, and it's not my research, but I think it might be interesting for listeners of your podcast while we're on the topic, is this flip side question. So we're asking, does your phase of the menstrual cycle affect your symptoms? Can we use that to maybe improve symptoms? But a big flip side question is actually, does having long COVID or MECFS, does that affect your menstrual cycle? And anecdotally, a lot of people will say, like, yeah, actually, my menstrual cycle's been quite messed up since I started to have long COVID CFS. And that's something that the paper from the Patient Collective that was recently published in Frontiers in Rehabilitative Science actually has a reasonable amount of studies on. And it seems to be a really common thing that people notice changes to their menstrual cycles in association with MECFS and also long COVID. And I think that will be quite an interesting thing to find out, not something that I'm working on myself. And another aspect of that I'm hearing a lot from my colleagues in, for example, general practice or gynecology, is we haven't even mentioned, but of course, I'm sure everyone in your podcast knows very well that this is a problem that predominantly affects women. But a lot of people in general practice are noticing that there's a big overlap between sort of some kinds of long COVID symptoms and symptoms of the perimenopause. And I think in terms of quality of life, that's definitely something that would be really interesting to look at, because just anecdotally, a lot of people are finding that, if you have someone who's potentially got both long COVID and perimenopause, if you just say, okay, we're going to set the long COVID aside for a while and we're going to worry about what we think might be perimenopause and we're going to see about treating that with HRT, a lot of people find that can be really helpful for them. And I think it would be great to understand properly if that's really happening or if this is just a series of anecdotal reports. And if it is really happening, again, why? What is it about long COVID that seems to make perimenopause symptoms worse? Can long COVID trigger menopause? Do they just happen to have sort of similar symptoms, so it kind of cross helps, or do they actually, does it genuinely exacerbate symptoms? I think that would be really, really important to know, and that's something I really hope someone will look at, because I think that's again something that could really, really help with quality of life for people who are living with long COVID.
Yeah, definitely. And I suppose it's also quite interesting. I think, it's quite difficult to quantify, because what is long COVID? What does long COVID actually include? Because it's a very big umbrella term. But I think most kind of anecdotal and possibly even actually evidence says that long COVID seems to affect more women than men. And is this to do with hormones? I mean, that would be an obvious answer, wouldn't it? But I don't know if there's anything to back that up.
Yeah, that's a really interesting one. And so, I mean, I don't think I've ever seen anything that doesn't say that it's a sort of female predominant disease. I don't think I've ever seen anything to the contrary of that. So I think we can pretty well agree on that. I mean, one very interesting question that something perhaps like the King's symptom study could address when you've got a lot of people is, if we start looking at people and we divvy them up, by what kind of hormones they're taking. Particularly the interesting thing to do would be to look at people who are taking gender affirming hormones because they're transitioning to being the other gender to what they started off as. It would be really, really interesting to know if that makes any difference to long COVID symptoms. And that's something like a massive study like the King's symptom study might be able to address. I don't know if they've got any plans to. It would be super interesting though.
Yeah, it would be, wouldn't it? Well, we'll give them this one for free.
Yeah. No need to thank us, Tim.
Yeah, amazing.
There's only really, one thought that I'd like to leave you with, or maybe two thoughts. Firstly, this idea that now, and particularly with long COVID, the experience of people who are living with it is so important for directing research. So, do get involved, even if you don't feel like you can get involved by, giving blood or answering survey questions or whatever. Your experience does actually make a difference to what we're studying. We would not have started studying this if it had not been for the experience of the long COVID community. And then more broadly speaking, mainly to all of your listeners out there who have periods or who maybe have withdrawal bleeds. So those are the bleeds you have if you stop taking your pill for a week. This is something that I think we need to talk about more. And again, coming back to this idea of lived experience, if people hadn't been talking to us about their periods, we wouldn't have thought to answer these questions. So really, just your experience matters, whether it's your experience of your long COVID or your experience of your menstrual cycle or your experience of your hormonal contraception or your experience of your HRT. All of this can inform research, and you telling us about it and talking to each other about it is really important. And I know you do that a lot already, but I just want to say keep going.
Yeah, well, thank you so much for joining me today and telling me all about your really, really exciting research, but and also, for everything that you are doing as well. So I will make sure that those links go into the show notes. So if anybody is interested in signing up for that or just reading a bit more about it, then please do. And yeah, all the best with the study, and maybe you'd come back and chat when you've got some results.
Oh my goodness, when I have results, I will absolutely come back and tell you all about them. I would be delighted to.
Amazing. Thank you so much. Thank you so much to all of my guests, and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/longcovidpod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. and do get in touch. I'd love to hear from you.